Good afternoon, Sault Ste. Marie and Algoma. Welcome to Special Report for Tuesday, September the 1st. We are waiting for Doug Ford's press conference, and today he's going to be with Christine Elliott, who's the Deputy Premier and Minister of Health, and Raymond Chow, who's the Minister for Seniors and Accessibility. They'll be coming to us from Queen's Park, but before we go there, we're going to go hit the weather. What's up there, Daniel?
Thank you very much, Chris, and good afternoon, everyone. It is now September 1st. We're moving right along here, getting closer to fall, and the temperatures are starting to show that in the mornings now. So today we're going to see a mix of sun and cloud. You're looking at a live view now, which is sponsored by wirelesscom.ca. Visit their website to check out all their telecommunications services they have available that may be able to help you. Looking at City Hall there with the river in the background, and we do have a few clouds kicking around today. Things will be all right. You will get down to a low of 14 though overnight, but we do have a 60% chance of showers overnight. Our weather is also brought to you by Northern Lights Detailing at 632 Great Northern Road, where they don't cut corners, they clean them. Check them out. They have many detailing packages available, and they also do quick car washes and just an interior vacuum, whatever you need. Just stop in and see Marnie there, and she will take care of you. Okay, your expected highs for today in the region: 21 in Thunder Bay, 19 in Wawa, 22 in Timmins, 23 here in Sault Ste. Marie, and then 24s in Elliott Lake and Sudbury. Expected lows: 13 in Thunder Bay and Wawa, 10 in Timmins, getting a little bit cool up there, 14 here in Sault Ste. Marie, 13 in Elliott Lake, and 14 in Sudbury. So getting into your 3-day, Wednesday's the day to enjoy at this point. We're looking at pretty much sun all day. Maybe the odd cloud will come in into the late afternoon and the evening. 22 degrees is your high on Wednesday, and the winds will pick up as well on Wednesday. They'll gust up to about 40 around noon, so keep that in mind. UV index will be 6. Overnight, we'll see 14 degrees and clear. And then Thursday is when we start to see a change here. We have periods of rain throughout the day with a risk of a thunderstorm. High of 21 and a low of 13 overnight and windy with a 40% chance of showers. Friday, you're looking at overcast, 16 degrees and a low of 11 with some cloudy periods as well. And getting into that long weekend. Saturday, we're going to see a mix of sun and cloud again, 17 degrees. Not too warm, but it's around seasonal. A low of 12 overnight. Sunday and Monday here, you're looking at some more rain and some showers and some unstable weather. It might be a mixed bag. At this point, we'll just keep monitoring it, and it'll be 19 and 15, and then Tuesday you're looking at 15 degrees as well with the sun and a few clouds kicking around on Tuesday. So look at those overnight lows. They're going from 14 all the way down to 10 by next week, so we're getting close to those single digits. It's coming, folks. All right, this is your weather watcher sent in for Sault Ste. Marie area, and it is a sunset on the lake, and like I mentioned this morning in the show, our sunset and sunrises are sun is getting shorter now. The amount of sun hours. In fact, your sunrise today was at 6:58 Eastern, and your sunset will be at 8:17 p.m. tonight. So less and less time to get out there. And so if you want to send in your weather watcher photos.
Ford at Queen's Park.
We've all stood behind our seniors. We rallied around them because, my friends, I just love our seniors as everyone else does. Through their hard work and sacrifice, they built this province. They worked hard to give us better lives, to leave us in a better position. And we need to recognize the sacrifice. We need to honor our seniors and work as hard for them as they work for us. And that's exactly what we're doing. Whether it's getting shovels in the ground faster to build new long-term care beds, investing $11 million to deliver meals, medicine, and other necessities, or mobilizing thousands of volunteers to support seniors in isolation. And I can tell you, traveling around Ontario, the dental care, it's the #1 issue I hear about from our seniors. And we're taking action. We're investing $90 million a year on free dental care for low-income seniors. Over 100,000 low-income seniors in Ontario will be able to receive care in a dental clinic and not in a hospital emergency room. 100,000 seniors will receive routine checkups, a preventative treatment they didn't have access to before. And we're not stopping there. We're enhancing that investment today because our seniors deserve the absolute best. I'm proud to announce the second phase of Ontario Seniors Dental Program. $25 million, 78 projects to build new dental clinics, to renovate existing ones, and create 8 more mobile units, to protect the smiles of all low-income seniors in communities across the province, to bring that dental care right to their doorstep and supporting those living in rural and remote areas, so our seniors will have access to modern clinics, equipped with the latest technology and tools. My friends, we will always look after our seniors. They deserve nothing less than to live with dignity and respect, and together we will ensure they can. Thank you, and God bless all our seniors, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon. Today's announcement is a reflection of our government's commitment to support Ontario seniors. Our government is taking steps to ensure low-income seniors have access to quality dental care they deserve. The reality is that 2/3 of low-income seniors do not have access to dental insurance. This means that seniors on a fixed income can find it difficult to afford the dental care they need. Seniors represent 30% of those receiving OHIP-insured dental services in hospital. This tells us that untreated oral health issues can lower seniors' quality of life and lead to the development of chronic diseases, and potentially increase visits to the emergency department from pain and complications that could have been avoided if they had access to the right care. That is why our government is investing $25 million in 78 dental infrastructure projects across Ontario to ensure seniors will have better and faster access to the services they need, no matter where they live. Once the Ontario Seniors Dental Care Program is fully operational, it is going to help approximately 100,000 low-income seniors get the care they need. This program is a key part of our plan to end hallway health care by providing seniors with access to quality dental care and keeping them out of hospitals. I'll now turn it over to Minister Cho.
Thank you, Minister Elliott. First, I'd like to thank Premier Ford and Minister Elliott. Your continued leadership and dedication are an inspiration. The health and well-being of our seniors is fundamentally important to our government. This province has been built through the efforts of our seniors. The life we live today is a testament to their ingenuity, tenacity, dogged determination to build a better world. I'm senior myself. We built this beautiful province, the best province in the best country in the world. Our seniors deserve the best treatment possible. That is why I am excited to speak with you today about the Seniors Dental Capital Program. In 2019, our government announced $19 million in annual investment for the Ontario's Senior Dental Care Program. The Seniors Dental Care Program provides free routine dental services for low-income seniors who are 65 or older. This program is good, not only for their physical health, but also for their mental health. Today's $25 million investment in the Seniors Dental Care Program will help to fund 78 critical dental infrastructure projects across the province. This will help provide dental services in underserviced areas, including funding 8 mobile dental clinics. These investments will make it easier for vulnerable seniors to access the dental care they need. Our seniors have stood by this province, and our government stands with them. Thank you.
Well, thank you, Raymond.
Now we'll go to the phone line for questions. Just a reminder that it's one question and one follow-up, please.
Your first question comes from Lucas Meyer with News Talk 1010. Please go ahead.
Hi, Lucas.
Hi, Premier. On education, some of our polling that came out today, paints a pretty concerning picture, and I know that you've talked about this before about potential outbreaks. You said yesterday they're going to come in like stormtroopers in case something happens. Yeah. But we have about 3/4 of parents who say that they're very concerned if an outbreak happens, and we're starting to see that across the province. So, I mean, for those parents who are concerned, I mean, how well equipped is the province right now? I mean, how do you deal with a classroom if it's going to be shut down for 2 weeks? How are children just going to automatically go online? Is our system capable of handling all that?
We are. We're very ready. I want to share the experience I had today over at a school, and I have to thank it's Kensington Community School, just not too far from Queen's Park here. And I have to thank the principal, Mr. Shepard. You talk about a gentleman that grabbed the bull by the horns. He's ready. He actually told me he's excited about the kids coming back to see him. But this is the attitude that I've been talking about, the can-do attitude. We're going to get through it. And I also have to thank Carlene Jackson, which is the director of the TDSB, and along with Alexandra Brown, too, the chair. So I want to thank all three of them. They were ready, they're geared up, and as they say, they have this. And what an incredible attitude. They're all champions. And I went through the whole school as if we were walking in as students and seeing the testing. But I'll pass this over to the Minister of Health. Thank you.
Well, we certainly know that many parents are concerned about sending their children back to school, given the COVID situation, and we have held that as we have formulated our plan. I certainly know that myself as a parent of 3 sons. I know that parents are concerned about their children. But that is something that has guided us and directed us. It has helped us with the work that we've done through Dr. Williams, our Chief Medical Officer of Health, and our Public Health Measures Table, our Health Command Table, and everyone advising the Minister of Education with respect to this plan. We have many layers of risk minimization put into this plan, from physical distancing, from wearing masks, to making sure that these students wash their hands on a regular basis, and through creating the pools of children that interact with each other. So we are ready for it. We can't reduce the risk to 0. That's not possible, but we've done everything possible working with the Ministry of Education to make sure that we have a safe, welcoming environment for students to come back into, and that we have a team of people that can step in if there are any outbreaks to deal with this quickly. Dr. Heyer is the head of our outbreak management team, that we have tested the outbreak management policies that we've developed to stress test them, to make sure that they are ready to go. If a student, a teacher, a staff member contracts COVID, we will be there to deal with it immediately. And of course, we have the 500 nurses, public health nurses that are being hired to help with families of schools to make sure that they can work with students, with teachers, and with families as well. So we have taken many steps, and I want parents to know that we have taken this knowing that they're concerned, and we've built in these stress mitigation factors to make sure that their students will be safe.
Follow-up?
Thank you very much. And Premier, I would like to go back to something that I asked you about yesterday, this whole question around collapsing classrooms. I got a number of messages since your comments yesterday saying that this is either happening or teachers are are unaware of their current assignments and that grades are being collapsed, etc. So can we just get some clarity over exactly what's going on here and just how much of a concern this should be to parents if, in fact, it is going to happen come September?
Sure, I'll pass to the Minister of Education. Thank you.
Yeah, thank you, Lucas. Every single year in the province of Ontario, there's timetabling taking place. What happens is school boards are on the front lines. They essentially ascertain how many children will be in class, and then correspondingly how many staff need to be in our schools to provide education for those kids in class. Because this year we're providing a remote option as well, it creates more of a challenge for school boards. So while this challenge of timetabling happens every single year, the difference is this year it's happening a bit earlier because school boards have asked parents to get us that clarity if their child will be in school or online. The fact is, school boards are working very hard. We just were at a school with the Premier, with the Chief Medical Officer, with Dr. Heyer, the Chair of the Board, the Director, the Principal. All of us were going through the school to understand how they are ensuring that they increase distancing, that they get the fundamentals right, as Minister Elliott and Dr. Williams have often said, on hand washing, on distancing, on masking. And by doing so, we ensure the classes are safe. We do believe that this will stabilize over the next few days once those final numbers are provided from parents to school boards, and that there'll be the right complement of teachers to support our kids. And so far, every school board has indicated that in the next few days, once parents give them that information, they'll be able to provide that confidence and that clarity to all parents who I know want it.
Next question.
Your next question comes from Sean Jeffords with the Canadian Press. Please go ahead.
Hi, Sean.
Good afternoon, Premier. I wanted to follow up on Lucas's question there. So Minister Lecce, it sounds like he's confirming what the Ontario School Boards Association has told us, which is that combining and collapsing of classes is going to happen this fall to account for students opting for online learning. Why did the government not provide school boards funding and use the online opt-out as a way to lower classes instead of filling those empty seats back in?
Yeah, no, what I did say, in fact, is that timetabling happens each and every year, that this is an experience that has happened irrespective of political party. It's the reality of parents saying, X amount of children will be in the school, and therefore the principal needs X amount of teachers. That is a ratio that gets decided based on students' enrollment in schools. And so the difference this year is that it's happening a bit earlier because we want to make sure we are ready for September, and we don't have parents walking in with children to the extent possible in September. We really want to mitigate that for the purposes of contact management and tracing and to ensure distancing. Now, with respect to investment, the province is investing upwards of $1 billion in new money to ensure that school boards have the latitude, have the ability to increase distancing, look to innovative options, including using outdoor spaces. I've been incredibly impressed. I mean, the Premier and I were with the principal earlier today and talking about the importance of outdoor learning. Which is important for air ventilation and quality. Talking about repurposing rooms, we saw libraries and staff rooms and other rooms being used for learning, really to ensure we maximize space and we mitigate the risk. And so the province is going to continue to give school boards those resources. We've just announced an additional $340 million, of which $170 million can go towards helping principals and school boards hire more teachers to ensure that those classes ultimately are as safe as humanly possible. And that's our commitment to parents.
Follow-up?
Yes, Minister, on the funding piece specifically, the issue here also really seems to be how the province dictates the way the funding is spent. My understanding is that school boards have to use the funding to fill these seats back in, that the province does not give them the option, largely, to lower class sizes. So why is the province sticking with this really rigid system that would prevent school boards from lowering class sizes or using funding that you're giving them to lower class sizes?
Yeah, well, respectfully, on the contrary, in Toronto District School Board, for example, they have already announced their intention to reduce classroom sizes specifically in those higher risk areas, particularly in the areas of higher transmission, the northeast, northwest of Toronto. Many other school boards are using that approach to really triage and focus on that higher risk community and making sure those schools have more educators and more distancing. There's been a decision point by boards right across the province to try to really respect the provincial average averages, to not exceed them, to reduce the amount of children in classes, to make sure we've got that distancing in place, which, as Dr. Williams and others have said, is important, especially when it's coupled with masking, with more hand hygiene, and a variety of other efforts to keep the schools and these classrooms more safe, including our buses. So the investments we're putting in place are, in fact, are helping school boards reduce classroom sizes, helping them increase distancing. And because Ontario has invested more than any province, it's giving our school boards a unique advantage to not only increase distancing, look to alternate spacing. It also allows us to create a credible online learning virtual platform where I have set out at least 75% of the instructional minutes, 75% of your child's learning day has to be done live through Zoom style learning, synchronous learning. And that's important that you know as well, that we have stood up to make sure that that experience is strengthened, and it's much more defensible for your child's learning in September, whatever happens. If they're remote, if you choose to put them on remote learning or in class, or if they're in high school, they're taking a blended approach. The bottom line is that learning will be stronger. And we're asking school boards to be able to ensure that those children are able to transition between both.
Next question.
Your next question comes from Brian Lilly with the Toronto Sun. Please go ahead.
How you doing, Brian?
Sorry, on mute. Hi, Premier. A question I'd like to hear from you on, but also Minister Elliott, Minister Lecce. Harvey Bischoff, the head of the OSSTF today, admitted in a radio interview that he's not a doctor. But when asked why he thinks that your plan signed off by numerous doctors isn't good enough, he said, well, essentially he wants you to listen to different doctors. Are you just listening? I'd like to hear how the process works. Are you just listening to Dr. Williams? Are you just getting advice that you want to hear? What is the process for taking something as essential as back to school and getting medical advice on it? Who do you talk to? Who do you hear from? How does this work?
Well, I've always said right from the beginning, first of all, I have all the confidence in the world in Dr. Williams and his whole entire team. And it's not just one doctor making a decision. It's multiple doctors around the table, along with the Minister of Health that heads up the table. So we take advice off many, many doctors, no matter if it's Dr. Heyer, as much as Dr. Williams is the Chief Medical Officer of Ontario. He heads up the medical team, but there's Dr. Yaffe, and I know other medical professionals sitting around the table, some of the best in the country, and our numbers speak for themselves for the great work that the docs have been doing, along with the frontline healthcare workers. I just want to point out just a couple points, Brian. Long-term care. We all know what happened on long-term care, and every day I check on the numbers. Out of close over 76,000 patients, we had 0 cases yesterday, and we had 1 case today. So I give all the credit to Minister Fullerton, Minister Elliott, and they're doing an incredible job along with the doctors. But I will pass this over to the Minister of Health. Thank you.
Well, as the Premier indicated, we don't just take the one opinion or an opinion that we want to hear. I have full confidence in Dr. Williams and the work that he's been doing. He's done his best to keep Ontarians safe, but it isn't just his opinion that we listen to. It's Dr. Williams as our Chief Medical Officer of Health, Dr. Yaffe, Dr. Vanessa Allen at Public Health Ontario. There are a number of physicians there that have been providing us with public health comments and advice. And there are also other doctors that come in and sit at our public health command table. So we hear a whole variety of voices and we listen to them. I'm not a doctor either, but I know that we need to listen to them. They are the experts. They know how to devise plans that are going to be safe for the people of Ontario, and our results in Ontario are showing it. So I have full confidence in both Dr. Williams and the entire team that's advising us.
Follow up.
The Chief Medical Officer of Health for Toronto, Dr. Eileen Davila, yesterday made a comment that we could all end up back in a lockdown if there is a spike in COVID again. So, Premier, do you support the idea of going into a lockdown again, the way we did, shutting down the full economy, if we end up with a second wave?
Well, first of all, I want to give a shout out to Dr. Davila. She's been outstanding, absolutely outstanding, dealing with the largest city in the entire country. She's doing a great job. But what Dr. Williams does, he reaches out to Dr. Davila and the other 33 chief medical officers. They come up with a consensus depending on the region. They also go back to the health table, and they're all doing a great job. But I'm not going to comment until, and God forbid that happens, until we get advice from the docs. And they give me great advice. And they never, I want to clarify something, they never tell me what I want to hear. They tell me the right, correct, professional health opinion and science behind any decision that they've told us. And so far, they've given us incredible advice.
Next question.
Your next question comes from Tina Yazjani with City News. Please go ahead.
Hey, Tina.
Hello.
You're breaking up a little bit, Tina. Can't hear you.
Sorry, Tina, can you start from the beginning of your question? We couldn't hear you.
I think you got a bad connection. Maybe we'll take the next
Yeah,
question,
go to the
and
next
maybe we can get back to you when we have a better reception.
Your next question comes from Chris Rishowi with the Toronto Star. Please go ahead.
Hi, Chris.
Hi there. Hi. My question is for you, Premier, and also Minister of Education. I just wanted to know during your school visit earlier today, what you thought of what you saw. Was there anything that gave you pause? Anything that you thought the school could or should be doing better?
No, I'll tell you this. Mr. Fisher's this guy's a champion. I'm telling you, he had everything. Just bang, 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 and it's the we can do it attitude that I just loved. And Carlene Jackson, the director, such a positive attitude, and they've thought of absolutely everything. So we lined up like we were the students, and socially distanced, walked in and we got the hand sanitizer and went through the whole process and looked at the classrooms and how creative Mr. Fisher has been is really amazing. He's utilizing all the spaces, no matter if it's the library or any other room that's available. As I told Mr. Fisher, the principal, we have to, and we have given everyone the tools and the resources and the financial resources to run the ship. At the end of the day, these principals are in charge of their own schools. They're the commanders and chiefs. They're in charge. They'll always have the support of the school boards and Ministry of Health and Minister of Education, but they're just doing an amazing job. So I'm going to pass it over to the Minister of Education, and he can tell you about the experience that he experienced as well.
Yeah, thank you. I think, what it underscored is the professionalism, the team spirit, and the hard work that has been undergone for the past many months by our principals, educators, public health, nurses, government, the Ministry of Education, all of us working at unprecedented speed just to get this right. And I'm incredibly impressed with the hard work and the thoughtfulness, the adherence to public health guidance. I think a few things that stood out for me is the fact that our schools have really taken a compassionate lens to making sure that our students feel supported from their mental health when they come back. The fact that there is clear signage all over the spaces, including floor markings, stairs that go up one way, another set of stairs that go down, really trying to make sure the flow, movement, the use of outdoor space, creatively looking to utilize all of their parking facilities and their recreation spaces so that learning could happen outside in September and October, weather permitting. And I love the fact that, every school board, I'm proud to report, has the PP they need. In fact, the principal advised the Premier, Dr. Williams, and I that they've got well over a month of supply and more if they need it. We've got a continuous supply of access to face masks, to hand sanitizer, to soap, and to all the things that our schools will need. So I guess my message is really one of optimism, that everyone is working hard. It's amazing to see that work in real time. And as the Premier mentioned, we literally were treated like a student at the front door, hand sanitizer, asked a series of questions. I mean, that process, I think, builds confidence. And I think as parents...